Hello, my name is Mary. I am a mother and also a person living with HIV. Today, I want to share with you my own story, as well as the stories of my friends who are also living with HIV. You are about to understand how HIV-related stigma and discrimination in healthcare settings are still the reality of our lives. When I gave birth to my first child, my baby Andy. While I was being wheeled in for a C-section, the nurse told me I would be sterilized. I didn't fully understand what this meant, but there was no opportunity to ask any questions. They told me I had to sign a paper, or they would not give me baby formula when the baby was born. So, I signed. Andy is always asking for a sibling, and it's so hard for me to come to terms with what happened to me and explain to him why I will never be able to have another child. But what hurts the most is the feeling of being violated and understanding that this was not recommended or needed to prevent vertical HIV transmission. My choices were taken, and my dreams were stolen from me. I feel ashamed that I cannot have more children. Unfortunately, stigma and discrimination in healthcare settings still exist, even after all these treatment advancements over the years. Some healthcare personnel still persist with prejudice and outdated information. I am not the only one who suffered from this. Next, let me introduce my friend Angel, a transgender woman, and the discrimination she experienced while doing routine checkups at the clinic.
Hi, I'm Angel, but every time I go to the clinic, they call me by the name I no longer use, Adam. I feel humiliated in front of everyone. It makes me reluctant to go back, even though my health is so important. But I don't feel like I'm treated as a person who I want to be.
Stigma comes to all of us, even when we reach out for support. Mike, a young man who uses drugs, was also mistreated when he went for harm reduction and treatment services.
I went to the healthcare center, hoping for recovery support, but instead, I was lectured by the doctor because I'm young. He asked me to repent and stop using drugs. It upset me so much, but I still wanted to stick with my harm reduction treatment. So, I ended up forcing myself to go back to that toxic and hostile environment.
Our experiences are just a small fraction of the thousands of people living with HIV who face stigma and discrimination in healthcare settings. The discrimination and human rights violations I experienced are examples of the ways in which the reproductive rights of women living with HIV are violated as a result of stigma. PLHIV Stigma Index Global Report reveals that 13% of people living with HIV have faced at least one experience of stigma and discrimination in healthcare settings due to our HIV status from the healthcare providers within the last 12 months. This proportion was almost double at 24.9% when looking at seeking care for non-HIV-related health needs. According to Confronting Coercion, 4.4% of women living with HIV reported experiences of coercive practices in the past 12 months, and 4% reported experiencing at least one form of mistreatment or abuse in the last 12 months. Nearly 20% of women living with HIV who participated in a Stigma Index 2.0 study reported experiencing some form of coercive practice in their lifetime. Everyone deserves fair treatment, free from stigma and discrimination. By staying informed about the latest science of HIV and understanding the unique intersectionalities of each individual, you can become a champion for equity and help transform health facilities into better places for people living with HIV. Every small step can make a big change. Together with the PLHIV Stigma Index, we can empower our community and generate evidence for actionable interventions. Let's work towards building healthcare systems that embrace everyone with inclusivity, ensuring no one is left behind.